Contrary to myth, Canada's response to the COVID-19 pandemic hasn't been an endorsement of big government, but an indictment of it. Canada is spending over $100 billion of taxpayers' money to deal with the fallout of COVID-19. That may be necessary now because of the seriousness of the pandemic. But if the federal government had simply listened to its own experts on its own committees that it appointed following the 2003 SARS epidemic, none of this would be happening. There have been 5 major studies since then, including the 2009 H1N1 pandemic. And all of them identified problems that are happening right now. Lack of testing, hospital overcrowding, lack of pandemic supplies, inability of the 3 levels of government in Canada to communicate with each other effectively. In terms of nursing homes, which are the epicenter of this, not just in Canada, but around the world, where 70% of the deaths in Ontario are happening in nursing homes, 80% in Quebec, 50% across the country, 50% in Europe. There have been criticisms and studies of the inadequate care of the elderly in our country for more than 50 years. I was reading a report in the 1960s from a Senate committee on long-term care that talked about they were inadequately staffed, they weren't safe, and the care in homes, and there's such a shortage of nursing homes that even bad nursing homes had long waiting lists to get in. Not all the nursing homes today are bad. Many of them are good, many of them have very good staff. But we've seen that in a number of these homes, seniors were abandoned. Why? Because the staff didn't have proper equipment and they left. If we had simply followed, if our governments had simply followed the advice that they asked for following repeated pandemics and epidemics in Canada, we wouldn't be in this mess. I'm Laurie Goldstein of the Toronto Sun. We're always interested in your views, and please follow us on Facebook and our YouTube channel.